kami dari grup 3A. Untuk tugasan GIT, kami dapat soalan 5. Kalau tengok soalan, kawan-kawan boleh tengok soalan. Soalan menyatakan Puan Zila yang baru didiagnos mengalami kegagalan renal akut telah dirancang untuk hemodialisis. Rawatan ini perlu dijalankan sebanyak 3 kali seminggu. Beliau sangat risau dan bimbang mengenai rawatan hemodialisis yang akan dijalani. Kita nampak ada 4 soalan di sini, A, B, C dan D. Okey, kawan-kawan boleh pilih nak soalan yang mana. Saya rasa soalan B boleh 2 orang. Dan saya bersetuju untuk ambil soalan B. Lagi seorang?
Saya pun akan ambil soalan B juga.
Okey, kiranya aku ambil lokasi. Kami jenis boleh?
Boleh.
Okey, boleh.
Soalan A. Soalan A saya nak ambil sebab saya suka soalan B.
Okey.
Untuk akademia, aku tak ada masa video. Soalan macam tu. Soalan B lah.
Saya sekali dengan NF tu.
Soalan B lah. Kerangka tanggungjawab jururawat.
Semasa presiden.
Nanti
Okey.
sekali lah.
Okey, semua dah dapat? Boleh ulang balik? A siapa?
Ya.
Okey.
Saya A.
B, aku dengan Maria. C.
T.
Okey, D.
Nasna.
Okey, baik. Itu saja daripada kami. Terima kasih.
My metric number is 3079. So today I'm going to talk about type of hemodialysis. There are actually 2 types of hemodialysis, which is the first one is in-center hemodialysis and the second one is HDD, which is home hemodialysis. The first one is in-center hemodialysis. It is need to be done 3 times per week. It will take around 5 to 6 hours per session. The patient needs to come to the hospital or dialysis center. Patients also will be supervised by the staff nurse. And the last one is it is suitable for new patient like Puan Zila who need a close monitoring. The advantage of in-center hemodialysis is it is safe and will be supervised by the staff nurse. The disadvantage is the time is fixed, so you have to follow the time that are set by the hospital. The second one is HDD or home hemodialysis. Patient will be done it by themselves or caregiver after receiving training. It allows patient to be more flexible in time and patient will be more independent. The third one is it is provide better control of blood pressure and fewer diet restriction. There are 3 subtypes of home hemodialysis. The first one is conventional hemodialysis. The patient need to do it 3 times per week. Each session may take around 5 to 6 hours. It's just like like in the center hemodialysis. The difference is you need to do it by yourself. The second one is short daily hemodialysis. You will take only 2 to 3 hours per session, but need to do it 5 to 6 times per week. It helps to remove the toxin in the body. And the third one is nocturnal hemodialysis. It will be done at night when patient is sleeping. It is done 6 to 8 hours and need to be done 3 to 6 nights.
Hello everyone, my name is Mara Batrisha binti Zainul and my metric number is 2400300N0. So I will explain about type of vascular access for hemodialysis. There are three main types of vascular access. First, arteriovenous fistula, which is we call AV fistula. A fistula is created by surgical connecting an artery and a vein. It takes several weeks to mature before it can be used. The AV fistula is considered the best type of access because it lasts longer, has a lower risk of infection, and provides better blood flow. Second, arteriovenous graft, which is AV graft. A graft uses a synthetic tube to connect an artery and a vein, and it is usually used when the patient veins are too small to create a fistula. It can be used sooner than a fistula, but it tends to clot more easily and has a slightly higher risk of infection. Lastly, central venous catheter, CVC. A catheter is a flexible tube inserted into a large blood vessel. It is usually used for a short-term access, for example, when a patient is near to dialysis or in emergency situations. However, catheters have a higher risk of infection compared to fistula and graft.
Hi, my name is Arif Irshad Biatman. My metric number is 24003065. Okay, now I will explain about locations of vascular access for hemodialysis. Okay, let's go. The vascular access for hemodialysis can be created in several body locations depending on the type of access used. For an arteriovenous AV fistula, the access is usually created in the forearm or upper arm, where an artery and a vein are surgically connected to allow strong blood flow for dialysis. For an arteriovenous AV graft, the graft can be placed in the forearm, upper arm, or sometimes in the thigh, especially when the veins in the arm not suitable. Meanwhile, for a central venous catheter (CVC), the catheter is inserted into a large vein in the neck, internal jugular vein, chest, subclavian vein, or groin femoral vein for temporary or emergency hemodialysis access. That's all. Thank you.
Hi, my name is Nur Anati Soleha, and today I will show you about the process of hemodialysis.
Have you ever wondered how hemodialysis works to save life? Hemodialysis is a medical procedure used to remove waste product and excess fluid from the blood when the kidney can no longer perform this function. The process begins by establishing access to patient's bloodstream, typically through a fistula, a surgically created connection between an artery, the vein, or a catheter inserted into a large vein. Blood is then drawn from body and pumped into a dialysis machine where it passes through a dialyzer, also known as artificial kidney, which contains a semi-permeable membrane. This membrane allows waste product and excess electrolyte to diffuse out of the blood while retaining essential blood cell and protein. The clean blood is then returned to the patient's body. A typical hemodialysis session lasts about 3 to 5 hours and usually performed 3 times a week. Throughout the procedure, healthcare professionals closely monitor the patient's vital signs and the efficiency of the dialysis to ensure both safety and effectiveness.
And now, I will pass to my friend Ain to show more about the hemodialysis.
Thank you, Anatis. So, my name is Nur Abitul Ghaffar. My message number is 24003127. And I will be presenting another example of a hemodialysis animation video. Ever wonder how dialysis actually works? If your kidneys stop doing their job removing waste, extra fluids and toxins from your blood, dialysis steps in to take over. There are 2 main types, hemolysis and peritoneal dialysis. In hemodialysis, your blood is pumped out of your body through a machine called a dialyzer. Instead, it's passed through a special filter that removes waste and excess fluids before it returns to your body. Kind of like an artificial kidney, this usually happens 3 times a week and takes about 4 hours per session. Peritoneal dialysis, on the other hand, use the lining of your abdomen as a natural filter. A cleansing fluid is pumped into your belly, absorbs the waste, then gets drained out, usually done at home daily. While neither method cause kidney failure, both are life-saving ways to keep your blood clean when your kidneys can't. That's all for me. I will pass to the next person. Thank you.
Hi, Assalamualaikum and good evening. My name is Ainatus Zaimi, 3089, and this is my friend.
I'm Siti Sadithya Azhar, 2403125.
Okay, and today we're going to talk about the nurse's responsibility during hemodialysis. Okay, I'm going to explain the first part, the first half of it, and my friend will explain the rest. Let's get started. Hi, I'm Anatul, 3089. Now I'm going to explain the first half of it. First is, we need to monitor patient vital signs like blood pressure, pulse, and respiratory rate. Rationale to detect early signs of complications such as hypotension or hypertension during the procedure. Second is, observe patient for symptoms of disequilibrium, syndromes such as headache, nausea, and confusion. Rationale to prevent and manage neurological symptoms caused by rapid change in blood solute level. Third is, maintain aseptic technique during all vascular access manipulations. Rationale to prevent bloodstream infection and sepsis, which are common risks in dialysis patients. Fourth is, monitor the functioning of the dialysis machine, including pressure readings and alarm system, to ensure the hemodialysis process is running safely and effectively. Fifth is, assess the blood flow rate and ensure it matches the prescribed settings. Rationale to achieve adequate clearance of toxin and maintain treatment effectiveness. And sixth is check ultrafiltration rate and patient tolerance to fluid removal. Rationale to prevent hypertension or cramps caused by excessive fluid removal. Next, who's now going to continue the rest of the nurse's responsibility. That's all.
Hi, it's me Husna, and it's my turn to continue the rest of nursing responsibility during hemodialysis. Number 7 is observe for the bleeding at the access site and any clothing in the extracorporeal secret for rational to prevent blood loss and ensure the secret remains functional throughout the procedure. Number 8 is maintain patient comfort and safety, for example, proper positioning. Rational to promote relaxation during long dialysis session. Number 9 is communicate regularly with patient about any unusual symptoms, for example, dizziness, chest pains, for rational to detect early complications such as cardiac arrest. Number 10 is document dialysis. Parameters such as blood flow, ultrafiltration volume, pressure and patient response. Rational to provide an accurate record for ongoing evaluation. Number 11 is administer medication as prescribed by the doctor, for example heparin. Rational to prevent bloating and maintain patency of the dialysis circuit. Number 12, last but not least, provide emotional support and to provide emotional support throughout the procedure. Rational to reduce anxiety and promote a positive patient experience during treatment.
Okay, that's all from us. Thank you.